right, class. Today, we're diving into a fascinating and crucial topic, preterm and postterm newborns. These are two ends of the gestational spectrum, and both require unique care. So, let's start with preterm newborns. Imagine you're in the NICU, and a tiny baby is born at just 28 weeks. What would you notice first? Preterm newborns. Picture this little one, tiny, fragile, with skin so translucent you can see the veins. That's a preterm newborn. Let's break it down. One description. Preterm babies are born before 37 weeks. Their organs are still under construction. Think of it like a house without windows or a heating system. What does this mean? They have challenges like breathing issues because their lungs don't produce enough surfactant, trouble staying warm due to thin skin and no fat reserves, difficulty feeding because their sucking reflex isn't fully developed, and weak immunity, making them vulnerable to infections. Visual aid, display an image of a preterm newborn with key features highlighted. Now, when you assess a preterm baby, keep these critical areas in mind. Respiration. Look for signs like grunting or nasal flaring. Write this down. It's a common exam question. Temperature. Take frequent readings. Hypothermia is a big risk. Feeding. Monitor their weight gain and check if they're tolerating feeds. Neurological checks. Test reflexes like sucking and rooting. Weak reflexes can tell you a lot. Interventions. So what can we do to help these tiny warriors thrive? 1. Respiratory support. They might need oxygen, CPAP, or even surfactant therapy. Think of surfactant as the oil that keeps their lungs' machinery running smoothly. 2. Thermoregulation. Use incubators or radiant warmers. And hey, have you heard of kangaroo care? It's skin-to-skin contact, and it's magical for preemies. 3. Nutrition. Feed them breast milk through a tube if needed. It's like giving them superpowers against infections. 4. Prevent infections. Strict hand hygiene and antibiotics if required. And remember, parents are part of the care team. Teach them how to hold their baby safely and watch for warning signs. Got it? Take a deep breath, because now we're jumping to the other end of the spectrum, postterm newborns. Imagine a baby born at 43 weeks. What might they look like? Postterm newborns. These babies often have dry, peeling skin, like they've overstayed their welcome in the womb. But the real worry is what's happening inside. Placental aging means less oxygen and nutrients. Let's decode this. 1. Description. A postterm baby might have dry, cracked skin with less vernix, long nails and lots of hair, like they skipped the newborn phase entirely, a thin, wasted appearance due to lost fat, and meconium staining. If you see greenish discoloration, think meconium aspiration, a serious complication. 2. Assessment. Your assessment focuses on respiratory distress. Watch for rapid breathing or grunting. Hypoglycemia. Check blood sugar frequently. Signs like jitteriness or lethargy are red flags. Jaundice. Examine their skin and sclera for yellowing and confirm with bilirubin levels. Birth injuries. Large babies are prone to shoulder dystocia or fractures during delivery. 3 interventions. Here's your toolkit for postterm babies. 1. Respiratory care. If there's meconium, suction the airways immediately. You might need oxygen or even mechanical ventilation. 2. Manage hypoglycemia. Early and frequent feeds are essential. If there's sugar drops, use IV dextrose. 3. Treat jaundice. Phototherapy works wonders for high bilirubin levels. Keep them hydrated. 4. Temperature control. Keep these babies warm, dry them thoroughly, and use warm blankets or heaters. And just like with preemies, educate the parents. They need to know how to spot feeding problems, hypoglycemia, or jaundice.